What is gastritis? Understanding causes and treatments of this common sickness. Understand the symptoms and seek treatments to prevent serious complications. Potential complications of untreated gastritis. 1. Anemia. Chronic gastritis can impair the absorption of iron and vitamin B12, leading to anemia. Symptoms include fatigue, weakness, dizziness, and shortness of breath. 2. Gastric ulcers. Persistent inflammation can cause stomach ulcers. If an ulcer perforates the stomach wall, contents can leak into the abdomen, leading to sepsis, a life-threatening inflammation requiring emergency surgery. 3. Increased cancer risk. Long-standing chronic gastritis, particularly that caused by H. pylori, can increase the risk of developing certain types of stomach cancer. What is gastritis? Gastritis is a common condition characterized by the inflammation of the stomach lining, leading to a range of uncomfortable symptoms. It's often a temporary irritation, but can become chronic if left unaddressed. Inflammation of the stomach lining causes pain, nausea, and indigestion. Common triggers include H. pylori infection, overuse of NSAIDs, nonsteroidal anti-inflammatory drugs, excessive alcohol consumption, and consumption of spicy or highly acidic foods. Symptoms typically present as upper abdominal discomfort, bloating, feelings of nausea, and in some severe instances, even gastrointestinal bleeding. What is gastritis? Gastritis is an inflammation of the stomach lining, the protective barrier against harsh digestive acids. This condition can manifest in two forms. Acute gastritis, a sudden onset, typically short-lived, often triggered by irritants like certain medications or alcohol. Chronic gastritis develops slowly over months or years, often linked to bacterial infections or autoimmune responses, and may persist unnoticed. When inflamed, the lining can become irritated, swollen, and in more severe cases, eroded. Erosive gastritis can lead to bleeding and ulcers, while non-erosive gastritis involves inflammation without such lesion. Acute versus chronic gastritis. Different faces of the same condition. 1. Acute gastritis. Onset. Sudden and often intense, appearing quickly after. Exposure to an irritant. Causes. Commonly triggered by short-term factors such as bacterial infections, high alcohol intake or overuse of NSAIDs. Symptoms. Typically sharp, distinct, and short-lived, including sudden abdominal pain, nausea, and vomiting. Prognosis. Often resolves quickly once the underlying cause is removed or treated with minimal long-term effects. 2. Chronic gastritis. Onset. Develops gradually over extended periods, sometimes months or even years, often unnoticed. Causes. Frequently associated with persistent issues like H. pylori infection, autoimmune conditions, or long-term exposure to irritants. Symptoms. May be mild or even absent for long stretches, but can include vague discomfort, bloating, or indigestion. Prognosis. Can lead to more significant long-term damage, including stomach atrophy and increased risk of ulcers or cancer if left unmanaged. Symptoms of gastritis. When to take notice. Many individuals with gastritis experience no symptoms, especially in the early stages. However, common indicators often include burning or gnawing pain in the upper abdomen, nausea and vomiting, bloating and a feeling of fullness, loss of appetite and unintended weight loss, frequent hiccups. Urgent warning signs. Immediate medical attention is crucial if you experience vomiting blood or notice black, tarry stools, as these indicate potential bleeding ulcers. The stomach 9's defense under attack. The stomach lining is a remarkable mucus barrier designed to shield against the corrosive effects of gastric acids essential for digestion. 1. Weakened barrier. Gastritis occurs when this vital protective barrier is compromised or damaged, leaving the underlying tissue exposed. 2. Acidic inflammation. This exposure allows stomach acids to inflame or even erode the delicate lining, leading to the characteristic symptoms of gastritis. 3. Potential complications. Untreated inflammation can progress to ulcers, internal bleeding, and, in rare instances, increase the long-term risk of stomach cancer. Top causes of gastritis. The usual suspects. 1. H. pylori infection. A widespread bacterial infection, Helicobacter pylori is a primary cause of chronic gastritis and peptic ulcers globally. 2. NSAIDs and alcohol. Frequent use of nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, aspirin, or naproxen, along with excessive alcohol consumption, can directly irritate and erode the stomach lining. 3. Stress and age. Severe stress from surgery, burns, or traumatic injury can induce gastritis. Additionally, older adults are more susceptible due to naturally thinning stomach lining. 4. Other factors. Autoimmune diseases, e.g., Crohn's, type 1 diabetes, HIV/AIDS, bile reflux, smoking, and parasitic infections can also contribute to the development of gastritis. Preventing gastritis. Adopting certain lifestyle changes and proactive measures can significantly reduce your risk of developing gastritis or managing its recurrence. 1. Avoid prolonged NSAID use without medical supervision and explore alternative pain relief options. 2. Limit alcohol intake and cease smoking to protect your stomach lining. 3. Manage stress effectively through techniques like mindfulness or exercise, as stress can exacerbate symptoms. 4. Maintain a balanced diet rich in whole foods and avoid excessive consumption of acidic, spicy, or fatty foods that can irritate the stomach. 5. Opt for smaller, more frequent meals instead of heavy ones to ease digestion. 6. Ensure proper food hygiene by eating only properly cooked foods to prevent infections. 7. Lessen caffeine intake as it can stimulate acid production. 8. Promptly treat H. pylori infections and practice good hand washing to prevent reinfection and reduce the risk of ulcers and stomach cancer. Diagnosing gastritis, tools and techniques. A thorough diagnosis of gastritis typically begins with a detailed medical history and a physical examination to confirm the condition and identify its cause. Several specific tests may be employed. 1. Non-invasive tests. H. pylori detection. Simple breath, blood, and stool tests are used to identify the presence of Helicobacter pylori, a common bacterial culprit. 2. Upper endoscopy direct visualization. A flexible tube with a camera is gently inserted down the throat to directly visualize the stomach lining, allowing for detailed inspection and biopsy collection if needed. 3. Barium swallow X-ray imaging. After ingesting a barium solution, X-rays are taken to highlight and reveal any abnormalities or damage to the stomach lining and upper digestive tract. Over-the-counter treatments and medications for gastritis. This presentation outlines effective over-the-counter strategies and medications to manage the discomfort of gastritis, offering practical advice for symptom relief and prevention. Why treat gastritis? Addressing gastritis is crucial not only for immediate symptom relief but also to prevent more severe complications that can arise from untreated or chronic inflammation. 1. Prevent complications. Untreated gastritis can escalate to serious conditions like stomach ulcers, internal bleeding, and irreversible damage to the stomach lining. 2. Early symptom relief. Prompt treatment helps alleviate acute discomfort, preventing the progression of symptoms and improving overall quality of life. 3. Reduce stomach acid. OTC treatments primarily focus on neutralizing existing stomach acid and reducing its production to soothe irritation and promote healing. Antacids. Fast symptom relief. Antacids are a cornerstone of immediate gastritis relief, working quickly to neutralize stomach acid and alleviate burning sensations. Mechanism. They directly neutralize stomach acid, reducing burning and pain upon contact. Common OTC brands. Readily available options include Tums, Maalox, Mylanta, and Gaviscon. Relief versus healing. While providing quick relief, it's important to note that antacids do not address or heal the underlying inflammation of the stomach lining. H2 blockers reduce acid production. H2 blockers offer a more sustained approach to managing gastritis by reducing the stomach's acid production for longer periods compared to antacids. 1. Mechanism of action. These medications work by blocking histamine receptors in the stomach, which are responsible for stimulating acid secretion. This leads to a significant decrease in overall acid production. 2. OTC examples. Popular over-the-counter H2 blockers include famotidine, commonly known as Pepcid, and ranitidine, Zantac, though ranitidine's availability is limited due to past recalls. 3. Duration of relief. H2 blockers provide longer-lasting relief than antacids, making them a suitable choice for individuals experiencing mild to moderate, but more persistent, gastritis symptoms. Proton pump inhibitors, PPIs, strong acid blockers. PPIs are the most potent class of acid-reducing medications available over the counter, offering significant relief for more severe and frequent gastritis symptoms. Mechanism. PPIs directly inhibit the proton pumps in the stomach lining, effectively blocking acid production at its source. OTC options. Widely available options include omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid. Usage guidance. Recommended for frequent or severe symptoms, they should generally be used for short periods unless specifically advised by a healthcare professional for longer-term management. Pepto-Bismol and bismuth subsalicylate. 1. Soothe stomach lining. Bismuth subsalicylate, the active ingredient in Pepto-Bismol, coats and protects the stomach lining, providing a soothing effect. 2. Aids H. pylori cases. It can be particularly helpful for mild gastritis, especially when related to H. pylori infection by helping to bind and remove certain toxins. 3. Reduces nausea and diarrhea. Beyond gastritis, it's also effective in reducing symptoms of nausea and diarrhea, making it a versatile over-the-counter option for digestive upsets. Lifestyle and dietary tips. Beyond medication, making strategic lifestyle and dietary adjustments can significantly support gastritis treatment and promote a healthier digestive system. Dietary restrictions. Avoid spicy, fatty, and highly acidic foods like coffee, tomato juice, and orange juice, which can irritate the stomach lining. Meal frequency. Opt for smaller, more frequent meals instead of large ones to reduce the burden and stress on your stomach. Avoid irritants. Limit or completely stop alcohol consumption and smoking, as both can hinder healing and exacerbate inflammation. Stress management. Implement relaxation techniques such as yoga, meditation, or deep breathing exercises to manage stress, a known trigger for gastritis symptoms. When to see a doctor. While OTC treatments are effective for many, there are clear indicators that professional medical attention is necessary to diagnose underlying issues and prevent serious complications. Persistent symptoms. If your symptoms do not improve or worsen after a few days despite consistent OTC treatment, it's time to consult a doctor. Severe symptoms. Seek immediate medical attention for severe pain, vomiting blood, black or tarry stools, or unexplained weight loss, as these can indicate serious complications. H. pylori infection. A doctor can test for and, if necessary, prescribe antibiotics to treat an H. pylori infection, which is a common cause of chronic gastritis. Kindly hit the subscribe button below right corner to support this channel, as we like to present to you valuable content for your better health and living.